my name is Shelby Hearn. I'm going to be talking about type 1 diabetes. In 2002, I was a 5th grader. I was learning math concepts, history dates, but I was also learning to live with type 1 diabetes. Type 1 diabetes is an autoimmune disease which stops the production of insulin in the body. So with that, there's obviously going to be certain treatments needed. It's commonly diagnosed mostly in children, but it of course can be diagnosed in adults. It comes on very suddenly and goes for a lifetime. It causes the pancreas to not work at all, so basically the patient will then have to work as the pancreas. If managed properly, you can have a great life, you can have a long, healthy lifestyle. If not managed properly, however, it can result in some pretty severe complications. So today I'm going to talk to you about the causes, the treatments, and the potential complications, and that way you can better understand how the disease works. So type 1 diabetes happens when the immune system destroys the pancreatic beta cells. These are the only beta cells in the body. They're the only cells that produce insulin. So that means that then the person is going to have to perform the functions of the pancreas. Right now, we're not fully sure on all the different causes of what makes one get diabetes, but a lot of research has shown links between genetics and environmental triggers. This one book written by Zachary Pierce in 2014 titled Type 1 Diabetes, Causes, Treatments, and Potential Complications mentions that if an immediate family member has type 1 diabetes, one's risk of developing the disease increases from 10 to 20%. That's a pretty significant increase. And he also goes on to explain that there's potential environmental factors, such as it tends to happen more with Caucasians, also Northern Europeans. So now that we understand how diabetes is caused, we can go into how a diabetic treats this disease. It's treated through 3 different things. It's treated through a balance of diet, blood glucose monitoring, and administering insulin. First off, a diabetic shouldn't eat a lot of simple sugars. Of course, if you have diabetes, you go to a birthday party, yes, please consume a piece of cake. You will survive, as long as you take your insulin. But it is important that a diabetic make sure that they are, one, stay hydrated, drinking the right amount of water, not eating a lot of foods that are high in sugars and carbohydrates. After that, it's important for the diabetic to monitor their blood sugar because the body doesn't do it automatically. So there's many different kits you can use. Here's mine for an example. It's just a simple little machine. You poke and give a small sample of blood on it. It'll tell you what your blood sugar is. Normal blood sugar ranges from 80 to 160. Anything that's not in that range, there's definitely a different treatment for each kind. And then after they know the blood sugar, the most important key factor is administering the insulin. A diabetic who takes insulin before or after they eat, also before they go to sleep. You can do it through syringe and bottle, such as this way. There's also insulin pumps which connect to your body and it'll give the insulin that way. So now that we have gone over the treatments and what a diabetic does in a typical day, we can talk about some of the different complications that can occur. There's more mild to severe complications. More short-term complications would involve low blood sugars. This is when the blood sugar drops way below 80 and it causes sometimes an immediate need for medical attention. If it's noticed early on, the diabetic normally can just get some sugar and be relieved. However, sometimes it can come on during sleep or it can just happen very suddenly and medical attention will be needed as the person starts to slip out of consciousness. Not probably a very fun situation. It's happened only a few times, luckily. But then, of course, with a prolonged lack of care and not treating the diabetes correctly, a lot of more severe complications can happen. A book written by David Levy in 2011 titled Type 1 Diabetes mentions that a prolonged lack of care can start to cause a lot of damage in the organs of the body. This can include the heart, the blood vessels, the nerve system, the eyes, and the kidneys. I know this firsthand. My dad, who also had type 1 diabetes, did not properly manage his diabetes mostly growing up, and it did cause his kidneys to fail, and that's not a fun process. That involves high medical expense, a lot of surgeries, transplants, everything, and can be really dangerous. So now that we know also the complications, I want to conclude my speech with just giving a little bit of information about the advancements in treatment that we do have. The National Institution of Health in 2010 mentions about a TEDdy study, which is working to find the environmental triggers and factors that cause diabetes. This will help researchers be able to find different ways that we can prevent the beta cells from being destroyed, which is awesome. And also, new technology comes out every day, every year. We come closer to finding a cure, but we also find different, more easier ways to manage through the different monitoring systems and administering insulin. So I would like to now conclude my speech. Thank you so much for listening.